Hi there, Caitlin. I'm calling to discuss the test that you had done earlier in the week. Is there anyone you would like in the room with you before we begin?
Hi, and no, that's all right. My husband's at work and I'll show him the recording after. But yeah, they told me that I'm diabetic. That can't be right, can it? I eat fairly healthy and I exercise about once a month. How's that even possible?
I know all this must be really stressful for you and your family. So today I just wanted to talk to you a little bit about what gestational diabetes is, where we can go from here in terms of treatment, and answer any questions that you might have. How does that sound?
That would be great. Can you please explain why this happened to me?
For sure. First, can you tell me what you know about gestational diabetes?
Yeah, nothing really, just what Google told me. So basically, just that it's something that fat people get, which is why I don't know how it happened to me.
Yeah, I know it can be difficult to find great information on the internet, especially about such an important topic. So let me explain and hopefully ease some of that confusion. Gestational diabetes occurs when a hormone from your placenta stops your body from using insulin. This is called insulin resistance, and it causes a buildup of sugars in your blood as they cannot be absorbed by the body. Does that make sense?
I think so. But what causes it? Did I do something wrong? My husband and I always try and eat healthy, and we only want what's best for the baby.
Yeah, you certainly didn't do anything wrong, and I know you want what's best for the baby. There are many different factors that can increase a person's risk of developing gestational diabetes, such as being overweight, having close family history of diabetes, being over the age of 25, and having polycystic ovarian syndrome. In your case, where you are over the age of 25 and have PCOS, both of those would be considered risk factors. Do you have anyone in your close family with diabetes?
I do actually. My brother has type 2 diabetes. I never knew I was such high risk. Is there anything that we can do to fix it now?
Yeah, so there are a few different things that we can do to lower your blood sugar for the rest of your pregnancy. These options vary from dietary changes to medications. In your case, your doctor is suggesting a few dietary and lifestyle changes. And if these changes do not lower your blood sugar, then we will be looking at a medication known as metformin or maybe insulin therapy. These will not be used until after you implement the lifestyle changes, as ideally we're hoping to bring your blood sugar down using diet and exercise alone.
Okay, that sounds good. But I want the best care possible. And Google told me that metformin is the best. Is that true? I want to know that there's evidence stating this just so I can make sure I have the best treatment before I take the medication.
Yeah, of course. So, when treating gestational diabetes with oral medications, there's two main options. There's a medication called metformin, and there's glyburide, another medication. Studies suggest that metformin should be considered the first choice oral medication, as it's shown more direct improvements for the fetus. Um, your practitioner chose this medication as you have a BMI that's lower, and you're not too far along in your pregnancy, and you have no previous history of gestational diabetes. So, that makes you the ideal candidate for this medication. How does that sound?
That makes me feel so much more comfortable about taking it. But the thing that I don't understand is why I'm not taking insulin already. My brother, who has type 2 diabetes, he takes it daily. Should I be doing that right now?
Yeah, so that's right. Type 2 diabetics often require insulin therapy if their sugars are uncontrolled. And in some cases, patients with gestational diabetes also require this type of treatment. However, in your case, your blood glucose is only slightly elevated, so we hope to lower it with dietary changes. But if after 1 to 2 weeks these changes, your glucose remains elevated, then you will be started on metformin, and if that's unsuccessful, you will be started on insulin.
Okay, then why don't we just start me on insulin now? I want this fixed as soon as possible.
Yeah, that's a great question. So while many pregnant people with gestational diabetes will ultimately require insulin therapy, there's evidence showing why metformin may be a safer alternative. So metformin has a lower risk of causing the baby's blood sugar to become too low, and it also does not cause the same amount of maternal weight gain that insulin does. Oral medications are often tried first, and if they fail, then insulin is implemented, as this is considered best practice by the Canadian Diabetes Association as well as the International Federation of Gynecology.
Okay, that makes sense. But what about my baby? How does diabetes affect her? My friend had gestational diabetes a few years ago, and her baby came out huge. Am I going to have a huge baby too?
Yeah, so that's a great question as well. There are a few ways that gestational diabetes can impact your baby as well as your labor. Firstly, it's true that there is a correlation between gestational diabetes and having a baby who's larger than average. That's called macrosomia, which just means that the baby grows too much. When caught early, it can be properly managed. Other risks include increased risk of preterm birth. However, again, if managed properly, this risk can be greatly minimized. Another risk is having large babies is the risk of the baby sustaining a birth injury, such as shoulder dystocia, which is an injury that occurs when one or both of the shoulders of the baby are too large to get through the mother's pelvis during delivery. I know all this sounds really scary, but that's not my intention. I just want to help educate you on the risks, but rest assured that since we've caught this pretty early, we will manage your diabetes and minimize the risk of these complications.
Okay, that does sound really scary, but I definitely feel like I know what I have to do now. Can you give me some ideas of dietary changes I should make? I normally eat pretty well, but during pregnancy, I've had so many cravings for sweets, and lots of healthy foods are making me feel nauseous.
Yeah, for sure. I know it can be so difficult to get those healthy foods in when you've had those cravings. We've already sent over a referral to a dietitian who can better work with you about your specific diet and ensure you're getting the right types of nutrients. That appointment's scheduled for next week. Until then, best practice suggests that you follow the Mediterranean diet, so that's effective in managing your blood glucose. This includes eating fruits, vegetables, whole grains, and fish while avoiding fatty foods and processed meat.
Okay, that makes me feel a bit better. Discussing it with a dietitian will definitely be good. Thank you for giving me that information, though. I certainly will start eating more of those foods.
Yeah, so no problem at all. I understand how difficult it can be, and I hope that this meeting eased some of your concerns. Do you have any more questions for me? I'll be seeing you again in a few days for a follow up and to recheck those sugars.
Okay. I don't think so. That really helped ease my concerns. I was so scared that something terrible was going to happen to me and my baby, but now I feel like we have this under control. Thank you so much.
Yeah, you're so welcome, and I'm glad you feel better. The main take home messages are understanding what gestational diabetes is, how we can treat it, the risks associated with it, and the importance of a proper diet and nutrition. Take it easy, and I'll see you on Friday for our follow up.
Great. Thanks. Bye.